Welcome, Third Rockers. This is musculoskeletal ultrasound case number 2. But before we begin talking about the 3-piece suit jockey with elbow pain, we wanted to tell you about our upcoming musculoskeletal ultrasound course in beautiful Las Vegas, Nevada on May 20th. Come learn how to do musculoskeletal ultrasound and see how this can help and improve your practice. So let's begin with case number 2, the 3-piece suit jockey with elbow pain. A 24-year-old gentleman shows up for evaluation of left elbow pain. He is dressed to the nines in a 3-piece suit holding his left arm with the elbow slightly flexed. The pain began yesterday and has progressively gotten worse. He had a fever to 101.5 earlier today. The pain is worse with any type of movement, and it seems to be better if he held his elbow in slight flexion. He's otherwise a healthy guy and denies any illicit drug use. Once you get him out of that 3-piece suit and into a more modest dressing gown, you note that his elbow is red and warm, which is slightly more prominent over his olecranon. So what do you do now? And is there something that you can do to quickly focus in on the question? Besides an x-ray, a CBC, and some inflammatory markers, the real question is, do you need to tap the joint? And speaking of tapping the joint, is there even a joint effusion to begin with? Really, this would be nice if it were just a simple olecranon bursitis. But if it's cellulitis, then I really don't want to risk seating the joint if I go ahead and do an arthrocentesis. Such tough decisions. But never fear. We're here to help by teaching you how to use point-of-care ultrasound to answer a few questions quickly and easily. First, let's get out our ultrasound machine and see if we can find an elbow effusion. When looking for an elbow effusion, we can potentially look in 3 areas, but we want to make this simple and easy. And when it really comes down to it, you really need to look at just one spot. We are already familiar with the 2 main recesses in the elbow that can be seen on a lateral elbow x-ray, simply known as the anterior or posterior fat pad sign. These fat pad signs occur when the fat pad that normally lives in the anterior or posterior recess of the elbow is displaced by fluid that has collected in the joint space. The easiest way to find an elbow effusion using ultrasound is to look in the posterior recess, also known as the olecranon fossa. We do this by placing the transducer just proximal to the olecranon with the elbow flexed at 90 degrees. Normally, the fat pad fills the olecranon fossa. In this transverse image of the normal elbow, we can see the olecranon fossa and the fat pad that is resting in the valley that exists between the trochlea and the capitellum. The black stripe that can be seen at the bottom of this valley isn't fluid, but actually hyaline cartilage from the articular surface of the joint. If we rotate the probe 90 degrees into the sagittal plane, we get a different perspective of the olecranon fossa, with the fat pad completely filling the olecranon fossa. With the joint effusion, the fat pad is displaced out of the recess, which is instead filled with fluid. You can see this in both the transverse and sagittal planes, but I think it's a bit easier to see in the transverse orientation. In the side-by-side view, you can clearly see the effusion outlined in blue, which has displaced the fat pad. This is easy to verify by rotating the probe again to the sagittal plane and identifying the fluid within the olecranon fossa. Looking for fluid in the anterior joint recess is just as sensitive as looking for fluid in the posterior joint space, but it's more difficult than the posterior approach, so we're not going to cover that in this case. Let's go back to our gentleman in the 3-piece suit. Fortunately, he already wants to hold that elbow in flexion. We place the probe posteriorly just above the olecranon and scan up in a transverse orientation until we find that valley we call the olecranon fossa. Our patient has fluid that has completely filled that valley. This is a decent-sized effusion, and it needs to be aspirated. The next awesome part is that ultrasound can help guide that aspiration, but that's for another time. You aspirate cloudy fluid from his joint space and send it for cell count, gram stain, and culture. When it comes back from the lab, he has 120,000 nucleated cells. You have made the diagnosis. This gentleman in a 3-piece suit has a septic joint, and now he's off to the OR for his joint to be washed out. Excellent. You did it, and fast. Point-of-care musculoskeletal ultrasound made your care of this suit jockey faster and more efficient. Well done. To learn more about musculoskeletal ultrasound and how it can improve your practice, go to emergencyultrasound.com and sign up for our next course in Las Vegas on May 20th. We look forward to seeing you there. Oh, and wait, I forgot to share one more great piece of information. If you sign up for our course within the next 2 weeks, you'll get access to our daily musculoskeletal ultrasound quizzes. These are daily quizzes or cases with nuggets to help you learn musculoskeletal ultrasound. So go to emergencyultrasound.com and sign up today.